So this is a genuine setback. This was not part of McConnell's roadmap, because the story about McConnell is he always sees 10 moves ahead on the chessboard versus anyone else, and that everything is going to plan. So in your sort of sense of this, he really thought he would be able to get a vote this week, and the level of opposition from both the moderates and the conservatives is not what he was expecting.
It was always a gamble, Joe, but never a fatal one. He could have always said, as he did, that he hopes to get it done this week, and just because he didn't doesn't mean he can never get it done. We saw this script play out in the House, a very similar one, opposition from moderates and from conservatives, seemingly irreconcilable. A vote was planned, a vote was pulled, and all of a sudden, out of nowhere, the bill came back to life after a lot of negotiations behind the scenes. We don't know how long this is going to take. We know that McConnell does not want to let this hang in perpetuity because they want to move on to other agenda items, and they want to get this off their plate because, frankly, the substance of this bill is not great politics. It's hard to sell. 22 million people lose their coverage under this bill, according to the CBO. 15 million just next year. The deficit savings are substantial, 321 billion or so. We don't know what that number is going to be by the end of it. Costs are going to go up next year and then come down after a few years, according to the CBO. Overall, tough politics, and it does not poll well.
No, you're right, Sahil. Tough politics is a great way to suggest it. Kevin, come in here and give us your thoughts. Clearly, Mitch McConnell must have come under a significant amount of pressure in order to make this decision today. The problem is the senators around him are going to become under increasing pressure as every day passes, under pressure from their voters to not make a decision that ultimately will hurt individual Americans as far as their healthcare coverage is concerned.
Julia, we're here at the White House. While we were getting from Capitol Hill to the White House, I was talking with several Republican sources, and they're saying what you're saying, which is Senate Majority Leader Mitch McConnell, of course, trying now to redraw the map, so to speak, and chart a new path forward. All of the senators have been invited here to the White House. Vice President Mike Pence working Capitol Hill earlier today, trying to muster enough votes for this health care passage, but at the end of the day, the numbers just didn't add up. The math wasn't there for the majority leader. He could only afford to lose about 2 votes, and the whip count of those opposed, even to bringing this health care bill to a vote, wasn't there. There was a handful of folks, people like from the far right, Senator Ted Cruz, and then more moderates like Senator Susan Collins. I mean, the policy differences on this couldn't be more different. I mean, you've got Susan Collins advocating for funding of Planned Parenthood, the far right, of course, against that. You've got more moderates proposing to boost opioid addiction programs from $2 billion that the majority leader proposed to $40 billion. Again, none of that in the bill as well. The majority leader has about $200 billion to play around with, and I would anticipate, according to the sources that I'm talking with, that $200 billion could come up for discussion here at the White House once we start to see Republicans coming in and trickling in. But I spoke with one prominent conservative activist who told me that as lawmakers head into the August recess, when first they're having to come home for the July 4th recess, it was a really tough sell for them, Julia, to be able to talk about this bill, which is being dubbed Obamacare Light, at town halls, at 4th of July picnics, barbecues. But you fast forward, and perhaps if they're able to get something passed before the August recess, that juxtaposed with some other pieces of legislation might be able to provide them some political cover. But right now, here at 1600 Pennsylvania Avenue, no political cover for Republicans at all.
And of course, Republican senators are reportedly going to the White House later this afternoon to discuss the health care bill with the president. Sahil, let me bring you into this conversation once again, because Mitch McConnell certainly drove and steered this whole process up until now. The secret closed-door meetings, the unveiling of the bill. To what extent will the White House be involved over the next week following the 4th of July recess once they try to go for it again?
A few things, Scarlett. Number one, we know that the last time around when this was in the House, the president didn't get involved until late in the process, and finally his involvement paid off. He managed to twist enough arms, make enough calls, and finally help get the number of Republicans on board. One thing to know is that the president is he's not a policy wonk on this. He's not a stickler for policy details. He had a Rose Garden ceremony for the House bill, and then later he called it mean. He's very open to what this bill does. He wants to be able to sign it. He wants to be able to get it off his plate, claim a legislative victory, say he delivered on the promise, this and move to tax cuts, which he's sounded a lot more animated about in these campaign-style rallies he's been giving. What he can do is try to corral Republicans politically, make the case to them of how important this is. Perhaps, you know, do a little wheeling dealing, promise to go to their districts and help them in their re-election fights, that sort of thing. And he's got some sticks to play around with as well, because we see a pro-Trump super PAC attacking Senator Dean Heller, the moderate Republican from Nevada, ahead of his re-election. This is an extraordinary thing for a group to attack a vulnerable member of their own party ahead of it. So, you know, the president he's the most powerful political player around this debate, and if he uses that effectively, he could potentially get this to the Senate. But right now, we don't know.